welcome to our latest episode of the Medical Fitness Podcast. My name is David Flench. I am the President and CEO of the Medical Fitness Association. We're thrilled to have with us today Veronica Lopez, who is the Vice President of Health Strategies with the YMCA of Greater Brandywine. Thanks for joining us today, Veronica.
Thanks, David. Thanks for that warm introduction. I'm thrilled to be here.
We're going to get into a lot of different questions really around your journey, your organization to get the MFA facility certification. But before we do that, maybe you can give our listeners a little bit of background about yourself.
Sure, I'm happy to. My name's Veronica Lopez. I am a registered nurse, and I joined the YMCA of Greater Brandywine in June of 2024 as their Vice President of Health Strategies. Before joining, I have a 30-year career in healthcare. I first started as a health educator and social worker, and then progressed on to nursing, and my entire career has been in community nursing. Personally, I come from a Cuban background. My parents immigrated here from Cuba for political purposes, and it's shaped who I am as a person, and I've had community as a focus my entire career. As evidenced by my social work and nursing background. I joined the YMCA because I saw that there was a huge opportunity to help folks understand that there is a connection so that the Y can be in the midstream of healthcare, where we have what folks do in the doctor's office is just a few minutes. It's a snapshot of the day. I've been on that side of it, and now coming over to the YMCA to say, well, what about the other 95% of your time, all the choices that you make and what you do to help maintain your health? So that's a little bit about me and why I joined the YMCA.
Great. And that's such a unique perspective that you have as a nurse with all the experience that you have on the healthcare side, really bringing that to the YMCA. That's I assume a pretty unique position. I've come to learn more and more about the YMCA of Greater Brandywine, and seems like you all are on the cutting edge of this. So that's great to see that's happened. So why don't we dive into what inspired the Y of Greater Brandywine to pursue certification through the Medical Fitness Association?
Well, kind of going back to the vision of showing folks the way of where the YMCA can help support health and wellness outside of the doctor's office. You spend such a small amount of time. We all know how much time we get in front of our healthcare provider, and so much of our health is determined by what we do outside of a doctor's office. The Y has always been there in that space, in the community, connecting folks in everyday life. We decided that we were uniquely positioned to support positive health outcomes on a daily basis, helping members of the community to implement the advice of their medical providers. So that was the vision. And then how to share that vision and get the buy-in is where the Medical Fitness Association comes in. We're able to kind of have that level of legitimacy that no other Y in the country has at this time. We hope that changes, and we hope to be a part of that change. But the fact that we're not doing surgery, right? We're not trying to replace what your healthcare providers do. We're trying to support it in a way that is easily accessible, is affordable, is equitable for everyone. So that's why we decided to pursue MFA certification. If I can kind of refer back to my healthcare side, there's OSHA, there's the Joint Commission of Accreditation, and this is sort of along those lines. It reminded me a lot of it when we were preparing for the audit, that there's all these things that you have to make sure that you have in place before you can be certified, and the MFA certification was very similar. It reminded me of that. It's very comprehensive, but it's doable.
It's funny you mentioned the Joint Commission, and I have a history of working for hospitals and healthcare systems, and so I was also very familiar with that. And the hospitals usually are not eager to go through their survey with
Sure.
those organizations. They're very intense and tons of preparation, and the process changed over the years where they can come at any time and
Yes.
things like that. I'm hopeful that you had a better experience, that it was, usually this is something that is voluntary, and you see it as a great benefit. And of course, the Joint Commission, if a hospital wants to be paid by CMS, they have to pass that. This is a little bit different, but I agree. There's a lot of similarities, and having a third party, can credit what you're doing. Why do you think? It's been about a year now that you've been certified. Why do you think that it was the right time to explore that type of certification?
We need to be in the midstream, right? So there's never going to be a perfect time. There's just never going to be a perfect time, especially for an organization our size. We're larger Y. We have 9 different branches. So when is it going to be perfect? Well, I don't know. So we decided that, look, this is what our vision is. We want to lend an air of legitimacy to what our vision is. And in order to do that, we're going to need to get MFA certified. So let's batten down the hatches and get it done. And I have to, always give a hat tip to our Chief Growth and Strategy Officer, Heather Wilson, who took the lead in this before I came on, and gave an amazing example of the power of vision and organization in kind of breaking down this bigger objective into smaller bite-sized pieces, and then chipping away at it a little at a time and getting it done. And we did. And to your point, David, it was definitely a pleasant experience to have you audit our facilities. So not quite the same level of stress as Jaco, but just that the thought about having these checkpoints that you have to go through and make sure that you have all these things taken care of is what it reminds me of, and just that stamp of approval. Having that stamp of approval lets the healthcare space know that we're serious here. We're not taking this lightly. We're taking it very seriously. Because we understand that we have to stay in our lane. We know that we are, again, we're not operating on people. We're not doing surgeries. We're trying to take care of all of the aspects of your health that are outside of the doctor's office and the hospital.
It's such a great vision. I can remember talking with Heather over a year ago, and how passionate she was about this vision to do something new at the Y, and she was bringing you on at the time. I remember that, and I thought that's just a great way to further connect. Like you said, you're not taking over things. You're complementing what the healthcare systems are trying to accomplish, and keeping people well. Programming for those who need some more help, and so it's more of a collaboration and partnership. It's great to see a lot of that coming to fruition, and I got to see kind of on the start of this journey, and as you went through, and now it's great seeing everything that's going on. But can you think back to some of the key steps that were involved in becoming certified, and really how long did it take as you were assembling your team and going through all the steps?
So we set a very high bar. I know that this process can take over 18 months. We did ours in less than that, and that speaks very much to the level of organization that we had. It's not an easy or a simple undertaking, but it's definitely something that if you're dedicated to the process and you assemble the right people, have the right people at the table, it is achievable. We assembled a cross-functional team. We had operations, wellness, safety and risk facilities to make sure that we checked off all the boxes, that we met all the criteria. We enhanced our documentation. We aligned protocols, elevated training opportunities, and enforced our already rigorous safety standards. And then in addition to that, we made sure that there was a culture shift, that we had folks understand why we were doing this, the why behind why we were doing this, and then had, again, the right people at the table who understood the vision we're able to see ahead of what was in front of us. And with that buy-in, we're able to say, okay, we all want to, many hands make light work. Like, we all want to do our best to help support this vision. And I shared the story of, I came on board in June of last year, and our first meeting, we were having weekly meetings at that point, and we had this huge spreadsheet that was projected up onto the screen, and the things that we had accomplished, that we were ready for audit, were green. The things that were halfway there but not quite were yellow. The things that we weren't there yet were red. And I remember the first meeting thinking, like, I don't know how we're going to do this, and we kept meeting and chipping away, and before it was time, we had everything green that needed to be green. And then we got a little bit competitive with it. Like, well, we don't want to just pass with the minimum. Like, we want to pass with more than the minimum. So we tightened up even more. And as you can attest to, we were able to pass with, I can't remember the exact score. I think it was a 97 point something. But we wanted to make sure that we were passing above what the minimum was. And we did that by having the right people at the table.
I'm sure that number will go to 100% for your recertification visit in I guess 4 years now on the 5-year cycle. But yeah, you spoke about getting the buy-in, and sometimes that is challenging, and just you mentioned that it can be overwhelming. We have 131 standards and guidelines that you have to pass 90% of them. So there's not a ton of wiggle room, but at the same time, like you mentioned, you don't try to do all of them at once. You take a strategic approach to it, and I can remember seeing your spreadsheets and very organized. It seemed like that was a way to help overcome some of those challenges for you.
Absolutely. Being that level of organized, if you pull up our screen, our shared folder of our health strategies work, it's so pretty. Like, it's color coded, it's all organized, and so it's very easy to stay organized. We can drop files in there. We had somebody that we added to our medical fitness task force who's a physician, so we were able to drop their resume and their information into that folder, so that it's just easy to, once you get that foundation set up that's super organized, it's just maintaining it, and then once in a while going through it and seeing, is there anything that we can kind of weed out of here? But we're so early in this process that we're not quite there yet. The other thing that I see in our future is making sure that we stay on top of our certifications, making sure that we stay on top of things, because just knowing from my healthcare background how quickly we can backslide into old ways, I think that it takes some time for everyone to understand that we're a medically certified fitness facility. We held ourselves to a higher standard, and that's not just, we're not just virtue signaling. That's not just talk. It means that in the everyday, we have to maintain those standards, not just for the audit. So keeping that top of mind, I've had meetings with our risk coordinator or our director of risk management, that I want to stay on top of this because it's easy to slide back. And so she's bought in. She's been a wonderful support. So we have other certifications that we have to maintain, do walkthrough and audits for. So we're kind of killing two birds with one stone there. So just that organization, staying on top of things.
Yeah, I think you bring up a really good point. I mean, hardwiring that into the fabric of the organization and making that just part of what you expect everybody to do all the time is really the way to do it. And it's part of the reason that we have a recertification process where we come back every 5 years, because it's easy to fall into bad habits of not tracking things the right way and documenting what needs to be documented, and doing all that really ensures that it stays part of what you do long term. So I'm glad to hear that you're recognizing that and it's not easy, but it makes you a better facility, right?
Absolutely. And that's something I think Probably, aquatics folks and Group X instructors. There's, here's what, like an example, Group X instructors, they can count down beats and they can lead a class according to the music, which I couldn't do to save my life. Like everybody be falling down on their face. Like I couldn't do that. But what I can do is if there's an emergency, without even thinking about it, I can do all the steps that need to be followed to respond to that emergency because it's something that's been ingrained in me. So I understand that the Y is a different world. And so I need to help folks along with this is how we're doing things because we're a medically certified facility. So it is going to take a little while, but we're working on it. We're doing it. And we're making progress in that direction that we have to kind of keep that in mind. Member information is something that we have to understand that we need to keep it a certain level of confidentiality and have HIPAA compliance and encrypted software and all of those things, which is new for the Y, but we're doing it.
Yeah, and you bring up some good points, and I can remember when I was a director of a certified medical fitness center, and you have to remember that you also have new staff coming aboard all the time that you have to train them on what to do, and you also have to remind them of the reasons behind it, and that this isn't your the old version of the Y. This is the new, an improved, a progressive way to be part of the healthcare systems and be part of that. It's just it's something that has to be done on a continuous basis, but certainly worth it. Let's jump into maybe some of the nuts and bolts of what what you did and what kind of documentation was required and what type of really changes operationally did you go through? How did you prepare? All of those sorts of things of what it looked like for you.
So for us, we had regularly scheduled meetings with folks at the table that were in charge of certain departments that fall under MFA certification. So we had safety and risk management, we had operations, we had a consultant who owns a physical therapy practice who came in as an outside view looking in. We had our operations, chief strategy and growth officer, senior director of wellness programming, all of us coming to the table and going through bit by bit everything that needed to be done. So, for example, one of the heavier lifts was, and I have to give a hat tip to Jackie Canan, who is our senior association director of wellness programs, making sure that everybody is NASM or some sort of nationally recognized certification, making sure everybody had that. Most of ours were through NASM, but making sure everybody is certified was a heavy lift because we have a lot of folks. So going after them, making it affordable for them, having them understand that they had to do continuing education, that was one of the bigger lifts. Then we had standardization of procedures, standard operating procedures, aligned protocols, buying a subscription to a Club Connect so that they could do their continuing education at no cost to them, getting them all entered into the the MFA website so that they can get access to regular newsletters and all the resources that are available on the website. There was a lot. I can't think of everything off the top of my head, but those were some of the big ones.
Yeah, I can remember interacting with Jackie, and I remember she was saying, we are also the most fun YMCA.
Yes.
Now it's fun to talk about that, but you can go through this and make it real, all serious all the time, or you can have some fun doing. And I think you've
absolutely,
that's part of your culture, and that's great because people understand this is a fun environment still. Yes, we're going through the certification that has a lot of requirements, and getting the staff trained is huge. And taking that knowledge base up a notch. That is a big part of the medical fitness model, is having some real experts being able to run programs and help the community. So that's great to hear that you were able to figure out how to do that. So, let's get into the impact and the value of this certification. What do you think has changed at the YMCA of Greater Brandywine since becoming certified?
Well, you'll never hear me stop saying for as long as it's true that we're the first in the country to have that to hold a certification. And that's a big deal. We've gotten a lot of interest from other YMCA's. How did you do it? How much was it? How long did it take? Is it worth it? And my answer to that is yes. I mean, we're from an internal standpoint, we are more aligned. Health strategies has become more central to our operations. Where people say, well, what is health strategies? And now a year on, they've learned what health strategies is. It's a larger umbrella and what falls under it, and why we have the department and what our plans are for doing it. And it's not a small task. It's a big ask to integrate into healthcare systems, especially in this area. So having that kind of level of legitimacy and having the ability to say that we're the only one in the country right now is a pretty nice thing. Externally, we have a different seat at the table, and I think that the intentionality behind bringing someone like myself on, who has a long history of healthcare experience in different capacities in community health, where I can speak the language of healthcare. So we have a different kind of seat at the table because of that. In addition to the MFA certification, it lets the outside world know, the healthcare partners outside of the Y know that we're here and we're serious about what our plan is, and that we're not trying to take anything away. We want to complement and support the healthcare system. The story that I frequently tell is that my last role was in a community-based organization and it was a volunteer-based organization, and I was trying to get a blood pressure program up and running. And because of our resources, I had very successfully done it in a previous role in a much larger facility. But because of a lot of different reasons, I wasn't able to get it off the ground in this particular facility. And if I had known that there was a partner out there that I could refer to and know that they were in good hands, I absolutely would have done that. So that was an eye-opener for me, that I can be on the solutions side of it, because I do deeply understand how difficult it is to be a healthcare worker. So that's what's changed, on a surface level. It also helps us with funders, seeing that we are a bridge between clinical services and the communities that are challenging to reach. And then also participating in the regularly scheduled regional conferences, and the annual one that's coming. It provides opportunity for networking. So we're getting our name out there as a medically certified fitness facility that we can help folks if they decide that they want to do it. And that's for YMCAs, for JCCs. That we're a resource to them.
It's interesting. There's been a misconception, I think, a lot of times of people thinking that the Medical Fitness Association is just for hospital-based facilities. And I guess that's where we kind of started as an organization over 30 years ago. But now, organizations like yourself got certified. Commercial fitness centers have been certified, Parks and Rec. We've had interest from JCCs and senior living. And so really, yes, there are certain components that being part of a hospital might help a little bit with, but you were able to, really look at the value and see that it can be done, even without that setting. You have a medical advisory committee going, and a lot of the people on that, it just seems like that was a great component of what you were doing. Have you seen some measurable benefits, like referral patterns and partnerships that are happening? I know you've implemented a fit truck, which I think is a really cool concept, bringing it out to the community. I'm sure you're getting more referrals into your program. What kind of things have you seen at that deep level?
So yes, so we do have the Fit Truck, which is we have the largest model and has office space in the back. It's a huge fitness truck on wheels that the flaps come up on the side and have full workout capabilities that we can take to underserved areas, and we can also take to corporate events. So that all goes back to health equity and expanding access to it. Especially Southern Chester County has difficulty with their public transit. There's transit deserts, there's food deserts, there's technology deserts. So we can come out there and help bridge that gap so that folks can get access to fitness when they otherwise might not be able to. And then on the back of the truck, there's that can be used for administrative work, or it could also be used for healthcare screenings. So that's another part. That's the second part. We're the only fit truck in the country that's using it that way, where we can partner with healthcare providers and have them do health screenings on the back of that truck. It's temperature controlled, which I say is like, that's a bonus. That I've definitely done community health in not temperature controlled environments. So it's got a fridge there. We can do vaccine outreaches. We can do school physicals, blood pressure checks, diabetes checks. And that's not the Y doing that. That's our partner, our healthcare partner would come in and utilize the back of the truck to do that in areas that they might not have a brick and mortar facility. And again, in Chester County and Southern Chester County, there's plenty of opportunity for that. There's plenty of places where folks don't have access that we can pull up and help folks out. So that's one of the ways that we're making an impact outside of our walls. And then you talked about the fit truck, and there was one other thing.
The referrals, how is that going?
So the referrals, we're building that out currently. We're working on our Prescribe the Y program, which I know has been done in many other Ys. So we're doing that along with an encrypted electronic health record system. So it's something that we're building up. Our evidence-based programs, our infrastructure is getting built up right now, and then will be launched. Our pilots will be launched at the end of August and early September. So more to come on that, but it's something that's helping us, and it's that we are able to kind of slap the medically certified fitness facility logo on there so that it kind of lends that legitimacy to us.
So you mentioned you're getting calls from other Ys. What would you and we have been too. It's great to see that there's several in New York that I was just on a call with earlier today, and
Mm-hmm.
All over the country we're getting this interest. And so what would you tell other YMCAs who are considering the medical fitness facility certification?
I would say to have their vision first and foremost. What is your vision for this? Because if it's something that you're going to go through the work of and the expense of getting it done, and then it sits up on a shelf, then maybe you got to circle back to your vision. So what is your vision? How can the MFA certification support that vision? That's first and foremost. So you begin with the end in mind, right? So you're doing that. And then the next thing is to get the right people at the table that believe in your vision. Once you do that and have somebody who's very organized, you can take the entire certification and chip away at it and make it into bite-sized pieces. And before you know it, you're on your way to becoming a medically certified fitness facility. So the very first thing I would say is the vision. Make sure the vision that there's alignment, because if there's not, then maybe it's not for you. The other thing, though, the flip side of that is if you have that vision and the medical fitness certification is going to support that vision and strengthen that vision, then don't wait until everything is perfect, because nothing's ever going to be perfect. So get folks that are like-minded, that believe in your vision, and to Jackie's point, have fun, be fun, be the most fun Y, because you have to you've got to have some snacks and some apple juice and just keep going.
The great thing you say is, don't wait if the time's not perfect. I mean, everyone is busy. We hear that a lot is, we've got so much going on. This is our busy time of year. And,
Yes.
it seems like, to me anyways, every year we get busier and busier. So it's easy to say, no, I can't do that now. But I think, it makes you a better facility. It differentiates you and just, the value of doing that. Do you think, are there tips within all of that to get the buy-in from the start, from leadership teams, or from even all the way throughout your staff? Is how do you best get that type of buy-in?
Having someone who has that clear vision so that it's easily seen, you're not looking at that vision through foggy glasses. If the vision is not clear, it is difficult to get the buy-in. And then connecting that to the impact. What is the impact for your community? The folks that work at the Y, all of us here, we tend to all have the same core within us that we want to support the mission. And in this case, it is expanding access and improving the health of Chester County. So when you have the right people at the table, and those are the folks you have to look for, because if you don't have those folks, you're going to have a really hard time. So people who believe in your vision, but the first step is making sure that you have that very clear vision and showing how it can be tied to improving outcomes in the community, because it can have a real impact. And the next thing is, let's not kid ourselves. It has to have a financial impact as well. So it can help grow your Y. It can help with increasing referrals to membership, increase your membership base, which then translates into increased dollars. I mean, we're a nonprofit, so we have to perform to a certain level in order to remain viable. So those are two things that I would say are really important to make sure that you have that crystal clear vision, and then to be able to demonstrate what the impact will be.
That's fantastic. Looking ahead, how do you plan to leverage the medical fitness facility certification moving forward?
Well, we see it as a first step, and it's a platform. And our vision is that there's going to be more Ys across the country that will have nurses and care navigators and health workers and social workers embedded into their care. We are just getting started, but that is absolutely part of my vision. I just was talking to my team about it yesterday and today, that we would love to have navigators that are able to connect, that they act as the conduits, the connectors between your doctor's office or your hospital discharge and our programming that's going to keep you well and keep you out of the hospital. We don't intend to become, I keep saying over and over again, we're not doing surgery. We are not intending to become clinics. We want to be community centered, medically credible, and focused on what we do best, which is helping members of the community create healthy habits that lead to better health outcomes.
I can remember my facilities getting certified, and one of the things that we had to do all the time was promote what it was to our staff, to leadership, to the doctors in the medical community, to our members. Have you taken any strategies to really promote what that was to various constituents?
So we have a health strategies quality team where all of the branches come together. There's selected leaders from the branches that come together. We come together very frequently, and I'm always sitting in on those meetings and bringing the information about medical fitness certification. When there's new folks, that we're letting them know as well. So we actually carve out intentional time. It's among other things, but we carve out this intentional time so that we keep that top of mind. And to your point, we're making sure that it's interwoven within our daily work.
What role do you see for the Medical Fitness Association and the broader YMCA movement in advancing medical fitness nationally?
That's a good question. So nationally, we would love to be a part of growing the number of YMCAs across the country that are medically certified. We want to be able to come together as a collective for a learning network, and also to, there's strength in numbers. So driving real systems change through having a collective of YMCAs that are medically certified. If there are a lot of us that are, again, I will say till the cows come home that we're the first ones, but we'd love to have companies so that we can have that strength in numbers, because the louder our voices, the better chance we have of being heard, for driving real policy change, and then also driving real reimbursement models so that your blood pressure self-monitoring program is something that is covered by your insurance company at a viable rate, so that we can continue to offer the program and scale the program. It is that, very often in the public health space and in healthcare, we talk about the very basic, like proper hand washing, and how that can help prevent disease, and how simple of an intervention it is. It doesn't cost a ton of money. So if you start with the simple stuff, that can really make a big impact. We can come together and say, look, we had a hand washing initiative, and this is the impact that it had. And then having healthcare organizations and insurance companies actually recognize that as a real intervention that pays off. That would be wonderful if we can do that on a national level. And together we can help support each other through any challenges that come around. If we're the only ones that are certified, it's all on us. And so if we have other YMCAs throughout the country who are certified, coming together as a collective just makes us stronger and more powerful. And it will show that healthcare is so much more than those few minutes that you have with your healthcare provider in the exam room. There's so much that happens outside of the exam room that we can be a part of to help you be a healthier person.
So well said. I always talk about how healthcare really does need to change from a sick care model to a
Absolutely
health and wellness model, and we're positioning facilities to do that. Yes, it's so great that the YMCA of Greater Brandywine is the first YMCA branches to achieve this. Expanding beyond we've had a little over 100 facilities go through this process in the 15 years that we've had this certification. But there are so many YMCAs that are some of them are doing such great work in chronic disease management and other programming, and probably are a lot closer to being able to do this than they realize. Some others may have to take greater steps, and everyone's at a little different point. But it's been just so great hearing your perspectives and the insight that you've provided in how you've done it. Is there anything else that you want to share with the listeners at this point?
Just go ahead and do it. If it's get that first step done, create that vision, that crystal clear vision, determine whether it makes sense for you. It probably does. And then start the work. Break it up from, this big bear of a certification. Break it into pieces. Get your spreadsheet with your yellow and your green and your red. And you'll be amazed that there's probably a lot of things that are yellow and green already, as you just said. And that can kind of put things into perspective, where you can see like, oh, it's not all red. Like I have some that are pretty close to being green, and I have a lot of yellows. And then organize and assemble very frequently so that you can start chipping away at all those things. So, and then in between those meetings, you have those, okay, risk, safety and risk. You're going to work on making sure that all the signs are this one facility didn't have signs on their wellness floor. You're going to make sure that happens so that we can check this off for next time. And then within a week or 2 weeks, it happens and you go to green. So, but none of that is going to happen if you don't first have the vision, You don't decide that it's right for you. It probably is. And then breaking it down, having that spreadsheet and breaking it down. Just do it. And we're here. We're here to, I personally am happy to help. If after listening to this, there's follow-up questions, please feel free to reach out to me. And David, you were always such a wonderful and responsive resource for us. We had little questions sometimes from those meetings, with little kind of nitty-gritty questions, and you were always very responsive and helpful.
It's my pleasure. It's something that I really believe in, and the model is something that I think as people adopt it and go through it, you see how much better of a facility you become, and the becoming different from what you were in a better way, and so I love hearing all this. Is there a best way to connect with you? Is it through social media? Is it email? Your website? How can people learn and connect with you even better?
So I am on LinkedIn as Veronica Lopez, and then I can be reached also by my email, which is V like Victor Lopez Lopez at YMCA GBW.org. And I'm happy to set up a meeting and talk further, or a phone call, or whatever it is. We can always do a tour of the facility just to give people a better idea of what we're doing here.
And like you said, it's something that I enjoy doing. I get calls and emails every week from people who are somewhere in the process, and part of my job is to really help them along that way, and so that's something I enjoy doing. So yeah, I enjoyed working with your crew, and so people can find us through medicalfitness.org online. I'm probably not as active on social media as I should be, but I do have a LinkedIn space as well. But thanks for sharing everything today. It's really been a pleasure talking with you about all of this.
Thank you, David. Thanks so much for having me, and I really appreciate your help and your support. And anytime.
Well, that'll wrap it up for today's episode of the Medical Fitness Podcast. Thanks again to Veronica Lopez from the YMCA of Greater Brandywine.